Good morning, students. Today's class we will see about the special senses, the physiology. The first question is organ of corte. It is a receptor organ for hearing. It is neuroepithelial structure in cochlea. It rests upon lip of the osseous spiral lamina and basal membrane. It extends throughout the cochlear duct for a short distance on either end. The organ of corte is made of sensory elements called hair cells and various supporting cells. All the cells of organ of corte are arranged in order from central towards the periphery of cochlea. First one is border cells. The columnar cells arranged in a single layer on the tympanic lip along the inner side of the inner hair cell. They have a cuticle. Second, inner hair cells. Flask-shaped cells arranged in a single layer on the upper part of the epithelial layer. Third is inner phalangeal cells are supporting cells of inner hair cells arranged in a row along the inner surface of the inner pillar cells. Fourth one is inner pillar cells. And fifth one is outer pillar cells. And sixth one is outer phalangeal cells, also called the cells of diators, are supporting cells of outer hair cells. Their columnar cells between the inner phalangeal and outer pillar cells is a fluid-filled space called space of Newell. The outer hair cells, they are also columnar cells occupying the superficial part of epithelium of organ of corte. They are supported by outer phalangeal cells. Cells of Hensen are tall columnar cells forming the outer border cells of organ of corte. They are arranged on basilar membrane. The space between outer phalangeal cells and the cells of Hensen are called outer tunnel. Cells of Cordius, cuboidal in nature and lying in lower surface of external spiral sulcus. Temporal membrane and lamina reticularis. Temporal membrane extends from the vestibular lip to the level of cells of Hensen. It is in contact with process of hair cells. The cuticular plates of all supporting cells are collectively form a reticular membrane, which is known as lamina reticularis. It covers the organ of corte. The inner and outer pillar cells, they are also known as the rods of corte. Each pillar cells have a base, body or a pillar and a head. A pillar cells form a series of arches that encloses a triangular tunnel called inner tube tunnel or cortex tunnel. Second question is rods and cones. The rods and cones are the sensitive portions of visual receptor cells, the rod cells and cone cells that present in the retina. They are sensitive receptors, photoreceptors or electromagnetic receptors. The distribution of cells is varied in different areas of retina. Fovea is a point of retina that have only cones and no rods. While moving from fovea towards the periphery of retina, the rod increases and the cones decreases in number. At periphery, retina has only rods and cones are absent. Structure of rod cells. The rod cell is a cylindrical in structure with a length of about 40 to 60 microns and diameter of 2 microns. The cone cells are in visual receptors with a length of 35 to 40 microns and diameter of 5 microns. The cells are flask shaped. The shape and length of the cones are different from in different part of retina. The cones in fovea are long similar to the rods, but nearing the periphery the cells are short and broad. The rods and cones of retina are formed of four parts that are called outer ligament, inner ligament, cell body, and synaptic terminal. The outer segment of the rod cell is formed of modified cilia and contains pile of free-floating flat membranes disc. The disc contains photosensitive pigment, the rhodopsin in rods and rhodopsin in cone cells. These pigments are synthesized by the inner segment. The cell body contains nucleus. The synaptic terminal contains synaptic vesicles which contain neurotransmitter glutamate. Pupillary reflex. Pupillary reflex are visceral reflex which alter the size of pupil. Pupillary reflex are classified into three types. Light reflex, when light is flashed into the eyes, pupil constricts, is also known as light reflex. It is of two types. Direct light reflex, when the light is thrown into one eye, the constriction of pupil occurs in that eye. It is known as a direct light reflex. Second is indirect light reflex. The light flashes onto the one eye. Constriction of pupil occurs in the opposite eye, even no light falls on that eye. Ciliospinal reflex. The painful stimulation of skin over the neck causes dilatation of pupil. It is called ciliospinal reflex. It is due to the contraction of dilator pupillar muscle. Sensory impulses pass through cutaneous afferent nerve. The center is in the first thoracic spinal segment. Accommodation reflex, it is an action when the person looks at a near object after seeing a far object. Three adjustments are made in the eyeballs. They are convergence of eyeball due to contraction of the medial recti, constriction of pupil due to contraction of the constrictor pupillae of iris, increase in anterior curvature of the lens due to the contraction of ciliary muscle. During accommodation, all adjustments are carried out simultaneously. Although accommodation is a reflex action, it can be controlled by willpower to a certain extent. Referred pain. The pain sensation is produced in some part of the body, is felt in other structures away from the place the pain development. It is known as referred pain. The deep pain and some visceral pain are referred to other parts, but the superficial pain is not referred. Mechanism of referred pain, dermatocele rule. The pain referred to a structure which is developed from the same dermaton from which the pain producing structure is developed. It is called dermatomal pain. A dermatome includes all structures or parts of the body which are innervated by afferent nerve fibers of one dorsal root. Functions of ear. It is an air-filled chamber, middle ear. It is an air-filled chamber, consists of tympanic membrane. It acts as a pressure receiver. It acts as a resonator. It critically dampens the sound wave. Ear ossicles, which magnify the intensity by 1.3 times of the sound. And eustachian tube. It connects middle of the ear to nasopharynx, thus helps to equalize the pressure on two sides of the tympanic membrane when atmospheric pressure decreases or increases. Muscles, the tensor tympani and stapedus, these can be reflexive, activated by loud sound, and this reflexively decreases the amplitude of sound vibration of tympanic membrane. Thus, they serve as a protective function by protection of the internal ear by loud sound. Refractory errors and their corrections. Any deviations in the refractory power from the normal condition resulting in inadequate focusing on retina is called ametropia. It is of two types: myopia of short-sightedness. In this person can see near object clearly but not the far object. It may be due to elongation of the eyeball due to stress and strain and increase in the optical power of the lens. The treatment is by using biconcave lens. Hypermetropia or long-sightedness. In this person can see far object clearly but not the near object. It may be due to shortening of the eyeball due to the stress and strain. Treatment is using biconvex lens. Presbyopia, long-sightedness of old age. As the age advances, the near point of vision recedes. The near point of vision increases. It usually starts around the age of 45 years. It is caused by weakening of ciliary muscles and decrease in the elasticity of the lens. Treatment is by biconcave and biconvex lens. Astigmatism, it is due to uneven surface of the cornea. The light rays focus at different planes. Treatment is with cylindrical lens. Color blindness. It is an inability to perceive one or more than one primary color. It is a sex-linked genetic disorder. Causes acquired color blindness include trauma to the eyes, chronic disease like glaucoma, retinitis, sickle cell anemia, leukemia, diabetes, liver disease, multiple sclerosis, drugs like antibiotics, antihypertensive, antituberculosis, barbiturate, toxins like fertilizers, carbon monoxide, carbon sulfide, alcoholism, aging. Classification of color blindness: monochromatism. It is a subject cannot appreciate any color. It is very rare. The retina of these people totally insensitive to color and they see whole spectrum in different shades of gray. Dichromatism. It is subject can appreciate only two colors. The two primary colors, the recipient of third color is defective. Trichromatism. These patients appreciate all three primary colors, but the intensity of one of these primary colors is not appreciated properly. Visual pathway. The retinal impulses are carried out to the visual center in cerebral cortex by nervous pathways called as visual pathway or optic pathway. Rods and cones present in the retina of the eye form the visual receptors. First order of neurons is bipolar cells in the retina. Second order of neurons are the ganglionic cell layer of retina. Third order of neurons are in the lateral geniculate body. The visual pathway consists of 6 components. Optic nerve, it is formed by axons and ganglionic cells. Optic nerve leaves the eyes through the optic disc. Fibers from the nasal part of retina are in the medial part of the nerve and carry impulse from the temporal half of the visual field of the same eye. Second is optic chiasma. The medial fibers of each optic nerve cross the midline and join uncrossed fibers of the opposite side to form the optic tract. Area crossing of optic fibers is called optic chiasma. Optic tract, it is formed by uncrossed fibers of the optic nerve on the same side and crossed fibers of optic nerve from the opposite side. All these fibers are optic tract are ran backward, outward and towards the cerebral peduncle. Lateral geniculate body. Majority of the fibers of optic tract terminate in lateral geniculate body, which forms subcortical center for visual sensation. From here, genicular calcarine tract or optic radiation arises. This tract is last relay of the visual pathway. Optic radiation. Fibers from lateral geniculate body passes through internal capsule and form optic radiation. Optic radiation ends in visual cortex. Visual cortex, the primary center for vision is called visual cortex and is located in the medial surface of occipital lobe. It is formed the walls and loops of calcarine fissures in the medial surface of the occipital lobe. Heat loss on exposure to hot environment. Cutaneous vasodilatation. By this process, the core heat is brought to the skin surface so that it can be lost surroundings by conduction, convection, and radiation. Sweating. This is only mechanism of heat loss when the person is exposed to environmental temperature greater than the body temperature. Anorexia. Loss of appetite will result in decreased food intake and decreased metabolic reactions, thus causing decreased heat production. Behavioral responses. This includes moving to shade or cooler place and decreased muscular activities. Panting, seen as in certain animals, not in humans. Heat gain on exposure to cold environment. Cutaneous vasoconstriction. Activation of posterior hypothalamus increases the sympathetic discharge. When body is exposed to cold atmosphere, it will lead to cutaneous vasoconstriction. As a result of heat loss from the core of the body to the cold environment is prevented. Piloerection. Cold can induce contraction of erector pili, that is cutaneous muscle. The body hair stands up, forming an additional insulating layer to conserve the heat. Measures for heat production include first shivering. It is due to increased discharge of the anterior horn cells of spinal cord, causing increased muscle tone throughout the body. Shivering can increase body temperature by 4 to 5 folds. Increased catecholamine production, which may induce chemical thermogenesis by increasing the rate of cellular metabolism. This can increase the body temperature by 10 to 15%. Increased secretion of thyroxine. Continuous exposure to severe cold can increase secretion of TSH, which can cause hyperplasia of thyroid gland. Heat production by brown fat. This occurs in infants in whom shivering does not occur. Increased metabolism of brown fat in infants causes increased heat production, and this is called non-shivering thermogenesis. Aqueous humor. The aqueous humor is a clear gelatinous fluid similar to plasma but containing low protein concentration. It is secreted from the ciliary epithelium, a structure supporting the lens. It is located in the anterior and posterior chambers of the eye, the space between the lens and cornea. It is not to be confused with vitreous humor, which is contained in the larger cavity of eye behind the lens. Functions: maintains intraocular pressure and inflates the globe of the eye. Provides nutrition like amino acid and glucose for avascular ocular tissues, posterior cornea, trabecular meshwork, lens and anterior vitreous. May serves to transport ascorbate in the anterior segment to act as an antioxidant agent. Presence of immunoglobulins indicate a role in immune response to defend against pathogen. Provides inflation for expansion of cornea and thus increased protection against dust, wind, pollen grains and some pathogens. Composition: amino acid transported by ciliary cells. Production and drainage: aqueous humor is secreted in the posterior chamber by ciliary body, specifically in the non-pigmented epithelium of the ciliary body. It flows through the narrow cleft between the front of the lens and back of the iris to escape to the pupil into the anterior chamber and then to drain out of the eye via trabecular meshwork. From here, it drains to Schellmann's canal by one of two ways: directly via aqueous vein to the episcleral vein or indirectly via collector channels to the episcleral vein by intrascleral plexus and eventually into the veins of the orbit. Primary taste sensation. The primary or fundamental taste sensation are divided into four groups: sweet. Sweet taste is produced mainly by organic substances like monosaccharides, polysaccharides, glycerol, alcohol, aldehydes, ketones, and chloroform. Inorganic substances which produce sweet taste are lead and beryllium. Salt taste. It is produced by chlorides of sodium, potassium and ammonium, nitrates of sodium and potassium. Sour taste. Sour taste is produced because of hydrogen ion in acids and acid salt. Bitter taste. It is produced by organic salt, substance like quinine, picric acid, bile salts, inorganic substance like saltas of calcium, magnesium and ammonium. Umami, it is recently recognized as a taste sensation. It is a Japanese term means delicious. Receptors of this taste respond to glutamate, which is common ingredient of Asian food. Functions of skin include first protective function, protection from bacteria and toxic substance. Skin covers the organ of body and protect the organs from having direct contact with external environment. Thus, it prevents bacterial infection. Protection from mechanical blow. Skin is not tightly placed over the underlying organs or tissues. In some, what loose and moves over the underlying subcutaneous tissues. So, mechanical impact of any blow to the skin is not transmitted to the underlying tissues. Protection from ultraviolet rays. Skin protect the body from ultraviolet rays of sunlight. Exposure to sunlight or to any other source of UV rays increases the production of melanin pigment in the skin and absorbs UV rays. Sensory function. Skin covered as the largest sense organ in the body. It helps the nerve endings which form the specialized cutaneous receptors. These receptors are stimulated by sensations of touch, pain, pressure or temperature sensation and convey these sensations to the brain via afferent nerves. Storage function. Skin stores fat, water, chloride and sugar. It can also store blood by dilatation of cutaneous blood vessels. Synthetic function. Vitamin D3 synthesized in the skin by action of UV rays from sunlight on cholesterol. Regulation of body temperature. Skin plays an important role in regulation of body temperature. Excess heat is lost from body by skin by radiation, conduction, convection, evaporation. Sweat glands of skin plays a major role in heat loss by secreting the sweat. Regulation of water and electrolyte balance. Skin regulate water and electrolyte balance by excreting water and salts to the sweat. Excretory function. Skin excretes small quantity of waste material like urea, salts and fatty substance. Absorptive function. Skin absorbs fat-soluble substance and some ointments. Secretory function. Skin secretes sweat through the sweat glands and sebum through the sebaceous glands. By secreting sweat, skin regulates body temperature and water balance. Sebum keeps the skin smooth and moist. Thank you. Thank you for listening.